And yeah, like I said, thank you all for joining us. I really appreciate your time and for tuning in here. This is a just a little plug for Boston Scientific has a great website, edcure.org, that has a lot of info just about ED in general and just in men's health. So this is a little plug for their website here. We go to the next slide. Well, yeah, so this is me, and as you can see here, and as you just heard, bounced around quite a bit for education and training, but eventually did what's called a fellowship in male fertility and sexual medicine up in Wisconsin. And so this kind of what we're going to talk about today, it's my specialty, and it's something like I enjoy helping guys out with, and it's important to me. So first up, we'll just start off with some general information about erectile dysfunction. So, what is it? So you can see the definition listed here. It's the inability to achieve or maintain an erection firm enough to have intercourse. I think a lot of guys envision ED as just like a total inability to get an erection, and it is that, but it's also having trouble keeping one or just not being able to get an erection hard enough for you to use. It's unfortunately super common, and it gets more common as we men get older. 50% of guys in their 50s have some degree of ED, 60% of guys in their 60s, 70% in their 70s, and so on and so forth. If you live long enough as a man, you're going to get ED at some point. So, how does it work exactly? So when you get aroused, there are some nerves around the penis that get activated. These, everything kind of relaxes down there, and blood flows into the penis. It makes it get hard and expand, and that expansion kind of compresses the veins in the penis, so blood can't leave the penis, and your penis stays erect. I kind of think of it like a hydraulic system. So when you get aroused, this hydraulic system gets triggered. The blood flows into your penis. It gets hard, and then eventually there's a pop-off valve triggered, and then the blood drains out. There are lots of causes of ED, but you can see the three most common causes are vascular, diabetes, and medications. And this makes sense, right? We just talked about how erections is getting erection is a blood flow process, and so anything that affects your vasculature or the ability for blood to flow into your penis and stay in your penis, it makes sense how that could cause ED. In terms of diabetes, diabetes is a nasty disease process that trashes small blood vessels and nerves, which are exactly what we need to get erections. So that makes sense. In terms of medications, I think there are literally hundreds of medications that can contribute to erectile dysfunction. ED can also be the result of prostate cancer treatments, and we'll talk a little bit more about that in a slide coming up. And then kind of flipping this relationship around, erectile dysfunction can also be the first symptom of some general health problems. I would probably diagnose a half a dozen guys with diabetes as a urologist every year from working up ED patients in my clinic. I also think if you see the blue bar down there, this is important to highlight. ED can have a broad negative impact on the health-related quality of life. Erectile dysfunction is a medical illness, or it's a medical diagnosis about your penis, but it affects you here too, right? Your sex life was something you enjoyed and part of your identity for so long, and then all of a sudden it's gone. Like, it definitely affects you mentally as well. So piggybacking on what we just talked about, sometimes erectile dysfunction can be the first symptom of heart disease. And I think this slide has some really interesting kind of stats and references on here. So as you can see, erectile dysfunction is an independent risk factor for future heart-related events. And I think it's really interesting that the severity of your erectile dysfunction can sometimes be correlated with the severity of your heart disease. And it's also interesting to note that erectile dysfunction shows up before heart disease symptoms almost 70% of the time. So why is this? I think this diagram is really good here. They kind of result from the same disease process. If you think about heart disease happens because the blood vessels in the heart get gunked up with plaque, and the heart is not getting the blood it needs to do its job. And ED kind of results from the same process, right? We just talked about, once again, how it's a blood flow issue, and the arteries and blood vessels in the penis can get gunked up with plaque as well. But then, as you can see here, the blood vessels in the penis are a lot smaller than the blood vessels in the heart. So it takes even less plaque for these vessels to kind of get gunked up and not work as well. It negatively affect that hydraulic system that we talked about earlier. I do talk about with patients, like, there's a little bit of data that through like improving your heart health and lifestyle modifications, that it maybe can make erections a little bit better. I think in reality, keeping your heart healthy probably helps you hold on to what you got for longer in terms of your erectile function. And what do I mean when I say, like, it's all the usual suspects, right? Diet, exercise, stop smoking, all that kind of stuff. So we'll talk a little bit about the relationship between low testosterone and erectile dysfunction. Low testosterone basically just occurs when your body, specifically your testicles, which are kind of the testosterone factories, just don't make enough testosterone. You can see here it's more common in men with obesity, diabetes, high blood pressure. That list looks very similar to the causes of ED, right? And this is just another disease process that gets more common as we get older. Normally, our testosterone's peak in our like 30s or maybe early 40s, and then things kind of slowly trend down from there. So to be diagnosed with low testosterone or hypogonadism, it usually involves 2 sets of labs done in the morning that show a low testosterone. If you get diagnosed with it, there's about a half a dozen treatment options. There are topicals like gels or patches. There's a few different types of pills. There's a few different types of injections. There's an intranasal. There's a lot of treatment options that exist now that weren't around 5 years ago. I think it's important to note that with the testosterone thing, so among guys that have low testosterone and ED, if we normalize your testosterone, still like 80% of guys will need some form of treatment for their erections as well. Testosterone, there's a lot of indications for doing it. There's a lot of things that it helps, but it's kind of crappy as just a solo ED treatment. So now we'll talk a little bit about the relationship between ED and prostate cancer treatments. And like we mentioned earlier, prostate cancer treatments can be a cause of erectile dysfunction. And the reason for that is anatomy. And that's what these pictures kind of try to demonstrate here. Basically, the nerves and blood vessels that help us get erections run kind of in and along our prostate. So any kind of treatment can potentially negatively affect those nerves and vessels and result in ED. Sometimes after these treatments, it can be temporary and things can get better, but sometimes it can be permanent. This is true after both radiation and prostatectomy or surgical removal of your prostate for cancer. All right, now we'll talk. I guess the good news is there's a handful of different treatment types available for ED, and we'll kind of run through all these. They all have unique pluses and minuses. And it's important, I guess, to kind of frame this discussion that ultimately the best treatment is the one that works the best for you and helps you achieve your goals. So first up are the oral medications. These work by making it easier for blood to flow into your penis and easier for blood to stay in your penis. This is where a lot of guys kind of start in their ED journey. They probably work in about 60 to 80% of guys, and they're safe. You can see the list of the most common side effects here: headache, facial flushing, runny nose, stomach side effects. Usually if these happen, oftentimes they're pretty mild, and it's more rare that they'd be bad enough that you would want to stop the medications. I guess a few kind of caveats to these. They do have some dangerous interactions with other medicines, and one of them mentioned here is where you can see it's mentioned as nitrates. These are medicines that are sometimes used for chest pain or heart failure, and the interaction of those with these erection medicines can be dangerous. Blood pressure bottoms out, it's emergency. There's certain of these medicines that if you take them after you eat, they're like half as effective. So that could present some logistical hurdles as well. And then I guess skipping down to the bottom, almost half of men who try oral medications will eventually have to move on to something else. And then I think that second bullet point is really important too. The medicines are less likely to be a long-term solution in guys with diabetes as well. Like we said, diabetes, nasty disease process. So the next step is intracavernosal injection. So this is a medicine that you inject directly into your penis itself. Normally you get an erection within like 5 to 15 minutes. These are pretty effective. Probably 85 to 90% of guys respond to these. But then as you can see here, almost half of men move on to something else, and usually relatively quickly after trying. You can see some of the side effects listed here. Pain with it's an injection. That prolonged erection, that's a dangerous side effect called priapism, and the risk is low but real here. Sometimes you can get a little scar tissue where you inject, or a little blood collection or bruising. And really, they list some of the most common reasons for discontinuation here. But I mean, in my experience, it's mostly like guys don't like sticking a needle in their penis whenever they want an erection, right? Like that makes sense. So they work really well. Satisfaction rate's probably about 50%. The next thing up are the vacuum erection devices. So this is literally a pump that you put on your penis. You pump it up, it draws blood into your penis, and then there's a band that you slide down onto the base. So it's probably a little bit more effective than what most guys think, but I don't know. And that's, on this slide, it lists the satisfaction rates is like 68 to 80%. I would say my real life experience matches more the study that's mentioned down next to the light bulb that found that the satisfaction rate was about 15% in guys after radical prostatectomy. So it's a little clunky to use. It can be uncomfortable. It's hard to sort of work it into your intimate encounters. And then it's also like with the band, it can be hard to ejaculate. And so, yeah, like I said, I probably estimate in real life the satisfaction rates with this one are close to 20% or so. The next thing would be a urethral suppository. Honestly, this is really just on here for the sake of completeness. Um, it's a little tablet that you slide down the tip of your penis, and theoretically it should work within 5 to 10 minutes. The success rates aren't very good, as you can see. It works in about half of people that try it, and one of the main side effects is genital pain, which occurs in about 50% of people and sometimes can be severe. So it's about as likely to cause pain in your penis as it is to work. You also, the first time you use it, you have to do it in a doctor's office because there's a low risk that you could pass out. And then insurance coverage for it is not very good either. So, like I said, I've maybe written one prescription for this in a decade. It's not a great solution for most guys. The last one that we'll talk about is the penile implant. And this is a device that is kind of all on the inside of your penis, where whenever you want to get an erection, you pump it up, you can get an erection whenever you want for as long as you want. And it's kind of all on the inside. So we'll talk about everything that's on this slide a little bit more. As you can see, 98% of patients were satisfied with this solution. And like I said, we'll expound on all these bullet points here in the next few slides. So there are three different types of implants. And if you start on the far right, the Tactra is a one-piece malleable implant. In the middle, the Ambicor is a two-piece inflatable implant. And on the left is the AMS 700, which is a three-piece inflatable implant. And this three-piece is the one that we'll talk a little bit more tonight, because I think for most guys, this would be the right choice. And I'll kind of explain why. So as you can see in this picture here, the three-piece has three pieces. There are paired inflatable cylinders that go into the erectile tissue in the penis. There's a water reservoir that goes deep down in your pelvis, and then there's a pump that goes down in your scrotum. So once again, it's all on the inside. Nobody knows it's there if you don't want them to. Whenever you want to get an erection, you pump it up, you get a good hard erection, and then whenever you're done, there's a little button that you press where it goes down. Like I said, you can use it for whenever you want for as long as you want. This one, and kind of why I mentioned like this is the right solution for most people. It provides the most natural result. When it's up, it's up. When it's down, it's down. Like I said, it's all on the inside. Nobody knows it's there. So like I said, I think for most people, this would be the right choice. It's important to note this is the only device that has a kind of an antibiotic coating sort of baked into the device, and there's evidence that does lower the risk of the device getting infected. And then the last thing on this slide that I like quite a bit is if you go down to the bottom next to the light bulb, this is not some sort of newfangled thing. Like we've been using these things for almost 5 decades. Over 500,000 men have received an implant. It's been in use for a long time. We've had some time to figure out things that work. And we've had some time to figure out, maybe more importantly, what doesn't work. And so let's see if this will work. So this is an animation that kind of gives you an X-ray view of how the 3-piece inflatable works. All right, so here we go. We're about to get the X-ray view of the device here. So once again, all on the inside. Whenever you want to use it, you pump it up and water flows from the reservoir into the device and you get a good hard erection. And then whenever you're done, you press the button, the water flows back into the reservoir. Once again, when it's up, it's up. When it's down, it's completely down. Some fine printy type stuff. We'll talk about actually some of this in the upcoming slides too. So like we talked about, it's a procedure to implant the device, and it's usually through an opening about that big. The opening can either be right above your penis or right below your penis. Most time I'll have my guys spend one night in the hospital with me and then they're home before lunchtime the next day. Normally after a few days of taking it easy, you can kind of start doing your normal stuff, normal routine. And it's 2 weeks of no heavy lifting or strenuous activity. I'll usually see guys back about a month after the procedure, and most guys are able to start using the device then. But if not, then the vast majority of guys are able to start using it within 6 weeks. So I'll just kind of read these are a few kind of testimonials from guys who had the implant and were very happy with the results. So you can see John on the left, ED probably the result from diabetes and blood pressure, had an implant for 15 years. And he says, it was the first time I had ever had surgery. And honestly, I was nervous, but recovery was pretty easy for me. Having the implant has been really great. I got my life back. And Cliff, who got an implant after a procedure for prostate cancer, said, what I've come to find out is that you're not alone in this. There's light at the end of the tunnel that may give you and your partner a new outlook on life and your personal relationship. So kind of getting into some of the summary slides here. So just to summarize, what are the good with the penile implant? So, we mentioned this earlier, and the right patient satisfaction rates are excellent. And then we mentioned the antibiotic coating, where there's data that shows that it lowers the risk of infection. Insurance coverage for these things is surprisingly good. They're covered by Medicare. If you've got Medicare with a supplement, you'll end up paying next to nothing. Most commercial insurance is covered, but not all. It's a permanent solution for a medical problem. You don't have to worry, is this medicine going to work? Am I going to have side effects? Am I going to keep having to pay money every month for the injection? Like it works. It kind of eliminates that doubt in your mind. And then the devices, the they're about almost 90% are still in use after 10 years. There's less than a 1% risk that it breaks per year. And then once again, as we mentioned, the result is really natural. When it's up, it's up. When it's down, it's down. It's all on the inside. You can use it whenever you want for as long as you want. And it does not interfere with the sensation of sex or your ability to orgasm. So it is a surgical procedure. So this is some of that like fine printy stuff from the video to talk about. So one, not everybody's a candidate for the procedure. I got some guys whose hearts just aren't healthy enough to have sex to begin with. I got some guys who are on blood thinners that we can't stop, so we can't safely do the procedure. I got some guys who have diabetes that's not controlled well enough to be able to do the procedure. Um, I also tell guys, I kind of compare it to a knee replacement. So that's a procedure where you're implanting hardware to fix a medical problem. And you can replace it, but then you can't pull it out and things go back to the way they were before. And that's how the implant is as well. Um, it's a device, so there is a chance that there can be some kind of mechanical failure or breakage. Like we talked about in the last slide, the risk of that's about less than 1% per year, and about 90% of the devices are still in use after 10 years. It is a procedure in a sensitive area, and so there's a recovery involved. There was a study published relatively recently that found that most guys were pain free by about 2 weeks following the surgery. Um, since it also is a device, there's a risk it can get infected. Um, and like I said, the implant has a kind of antibiotic coating built in to help with that. You'll get some hard hitting antibiotics through an IV at the time of the procedure that should help with that. And then I usually send guys home with a week of antibiotic pills to take afterwards. Maybe that part's voodoo, but I feel like that helps in that realm as well. There is some evidence that guys, if you have diabetes or a spinal cord injury, maybe that risk is closer to that 2% number. So in summary here, erectile dysfunction is unfortunately a super common problem and can be associated with other conditions or medical issues. And also, it affects your penis, but it affects you here too. There's a lot of different treatment options. Ultimately, the best one for you is the one that just helps you reach your goals in the bedroom. But for a lot of guys, a penile implant can offer a kind of a long-lasting, high satisfaction solution. And yeah, and so again, so on that last slide, they mentioned